There's no shortage of opinions on what the next school year should look like, but what do the students think about it all? NBC News spoke with kids about their experiences with remote learning as part of tonight's special, Coronavirus and the Classroom.
I feel like remote learning does not feel like it's still learning.
Well, it was kind of funner than real school. No, it wasn't.
I think I'm learning less when doing it online. When you're in regular school, you get to walk up to a teacher and ask her questions. And when you're at home, you can't do that.
You're gonna have to speak through technology, usually doing your electronic, doing Zoom or something, or like a Google Meet or something like that.
You're talking with someone that you're not seeing, and you're far away from, so you can't interact as much.
It's uncomfortable to me because my friends help me with my work and anything if I get confused what I'm on or what I'm doing.
In school, you could learn 2 lessons a day, but in online school they teach you 1 thing. And it goes on for the whole week. But in regular school, you can move on.
I just got sick of being in the same room all day.
I've enjoyed this remote learning, to be honest.
I want to be staying at home because school, I don't like that much.
School is worse, way worse.
Not even 1 hour in, I want to go home.
But during online school, it's actually easier to focus because there's not so many distractions.
Because you're just on a computer, so you don't have to rush. You could slow down while you're doing your work.
The teachers can't really yell at you and stuff. You can go to the bathroom anytime. You can eat and stuff like that.
I think it might have been an amazing experience because I think it might bring in a new class of education.
Being at home is too much of a good thing, and now I'm kind of tired of it.
Yeah, I'm just ready for coronavirus to be over.
You can watch more of our Coronavirus in the Classroom coverage tonight at 8 p.m. Eastern. Lester Holt anchors a special hour right here on NBC News Now. There is a startling new surge in coronavirus cases among children and teens right as they are heading back to school. Nearly half of all the pediatric coronavirus cases cropping up in a single month. That's according to a new report from the American Academy of Pediatrics. NBC News medical contributor Dr. Natalie Azar joins me now. Dr. Azar, it's great to see you. Why is this happening right now? What does this report say is going on here?
You know, Allison, I think that a couple of explanations for why we're seeing this is you really have to think about kids are a microcosm of the communities that they live in. And so in the areas in the South and the West that have seen such a significant surge in cases, this is where most of these cases in kids have been picked up. There's also the theory, of course, that they've just been gathering more as school let out. You know, when everybody was in lockdown in the spring, nobody was really, the kids weren't hanging out as much together. But now that the lockdowns lifted and school was over, people were definitely hanging out a little bit more. And of course, there is also some explanation to be tied into increased testing for obvious reasons. But that's not the whole explanation, of course.
What are your particular concerns about a spike like this coinciding with back to school time?
So, Allison, this is incredibly important. We've been talking about children and their risk of transmitting for quite some time now. The latest research really suggests that children above the age of 10 are just as likely or are able to just as efficiently transmit the virus as adults are. Now, kids younger than 10, elementary school, grade school children, we don't really know yet. We know that they have just as much virus in their, nasopharynx, in their nose and their throat as adults do, but we don't really have good data yet on how readily they transmit. So, if you speak to experts or if you listen to experts, they say you kind of have to talk about school in 2 different ways. One, talking about grade and elementary school, and maybe having a wholly different conversation about the safety of school reopening when it comes to the secondary schools.
In districts where students will be continuing to learn online and from home, Dr. Azar, what can parents do to boost their children's mental health while they're socially distancing? I know this can be a really difficult thing when kids are not able to be with their friends and to interact with other people their age.
Yeah, it is, Allison. And, things are starting to be, a lot of things are starting to be written about this, about the concern that this, potential toxic stress is having on kids, that they are, losing the stability of school, the social structure of school. They may have their own fears and anxieties. They may see fear and anxiety in their parents as well. For a lot of children, as well as many adults, their lives do revolve around a social structure. So one of the biggest concerns, or I should say sort of a collateral damage, is the concern about social media and all of the pitfalls there, that is all being exaggerated and enhanced because kids aren't able to interact with each other. And so they're interacting more on social media. So as a parent of two kids myself, that's something that I'm definitely keeping an eye on. Pediatricians and infectious disease specialists will say you can still gather with your friends, but wear masks, keep socially distanced, and do Zoom calls. We, the old-fashioned way, you and I, Allison, will pick up the phone and call someone. Children can do that with their smartphones also, and that's really important to reinforce just those connections to maintain that.
It's been one of the nicest things about the pandemic, Dr. Azar. I've actually picked up the phone and talked to people again instead of just texting like we all do so much.
Right.
How about adults? We know, right, exactly. We know it's not just kids. A CDC report found that adults are reporting more mental health issues over the past few months. What's your advice for adults who may be just feeling the negative mental and emotional effects of the pandemic?
Yeah, so here, I spoke to an expert today about this, and the way she described it was that, adults have this sort of attention triangle. You have your concern about your physical health, and you're balancing that with your concern about your emotional health, and then you're tying in your economic health into all of that. Basically, what experts are saying that at the community level, certain interventions or certain ways to prevent the fallout from this is to really strengthen the economic support and to lessen the financial stress among individuals. That's one of the biggest drivers for people experiencing this anxiety and depression. Other things to do, of course, and we talk about this a lot, is to address racial disparities, to expand access to social programs as well as comprehensive treatment. The CDC report that came out today was really, really shocking in that 10% of respondents overall, but 25% of young adults between the ages of 18 and 24 said that they had contemplated suicide in the last 30 days. Oh. And the numbers of individuals who were reporting anxiety, depression, as well as substance use was significantly higher, especially among caregivers and minorities. These are really vulnerable groups, and we need to be aware of this. We have been concerned about the potential for this public health crisis and mental health crisis for some time. Now we finally have some real data to corroborate that, and it needs to be top of mind, and we need to be proactive about it.
Dr. Azar, thank you so much for the reminder, because we've been talking so much about the virus itself, but there is that huge mental health component to this pandemic. Thanks for the reminder that we should really be paying attention to that as well.
Thanks, Allison.
700,000 students with special needs in the U.S. are also learning English. During the pandemic, that means that many immigrant parents are providing speech, occupational, and behavioral therapy all at home. Telemundo's Nicole Suarez joins us now. And Nicole, how are these parents dealing with such an incredible challenge, doing all of that learning at home?
Well, Allison, you can imagine it's been an immense challenge because these disabilities include autism, dyslexia, hearing impairments, visual impairments, which means that every single student is so unique and they require an individual lesson plan. And many teachers simply haven't been able to provide or fulfill those needs, communicating with parents who maybe don't speak English. I spoke to Soledad Picero. She is the mother of two beautiful twins, 6-year-old twins. Emma is autistic, and she says that she's been having a very difficult time with distance learning because she can't spend so many hours in front of a computer. And it's also been very anxiety-filled for her because it is lacking of the structure that she needs. Let's hear what she had to say. What have you learned as a mother of a special needs child?
I had to be patient. I didn't have that much patience before, but I had to develop that part of me. I have to run from one side of the house to the other side of the house with different computers so they can concentrate very well in her stuff. But you know, you have to be a mom. That's the moms do. It's like be there for your children.
And as you mentioned, she is not only teacher now, she is also therapist. Emma was used to working with 7 therapists every week, a teacher and an aide, so it's definitely been a change for her. Another challenge that parents also face is the lack of information in their language. So that's why Soledad created a website called Vida Autista, which she hopes to help other people with.
Oh, what an incredible job she is doing. I know it has to be such a challenge, Nicole. English language learners without special needs are facing challenges, too. What are some of the things that they're struggling with as they are trying to learn English from home?
Well, first and foremost, the most obvious one is the language, having to learn these lesson plans in a language that they're still getting used to, and also maybe not getting the support that they need from their parents because they simply don't speak English. They want to help with homework and coursework, but they are unsuccessful. Also, we have to analyze and think about exactly what these students are doing at home, what situation they're living in. Do they have a place where they can focus and study? Are they having to take care of their siblings? We know that 16% of the Latino population is not able to work from home right now during the pandemic. They are essential workers and they can't afford childcare. So that's a big responsibility for students at home.
What kind of impact could at-home learning, could the situation that these families are in potentially have on the Latino community here in the U.S. just the longer that this goes on, the longer we're in this pandemic?
Well, as you know, there was this educational gap that was already affecting communities of color and students of the Latino community disproportionately before the pandemic. That has only gotten worse now. And as you know, I mean, families right now are on survival mode. They're looking for the way to keep a roof over their heads, to put food on the table. So it's definitely been a challenge for them, and this could lead to student dropouts in high school.
Nicole, it's such an important story. Thank you so much for sharing the struggles that these families are going through. We really appreciate it.
Thank you, Allison.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.